Right now, while you are sitting here, something is happening inside your body that has nothing to do with what you ate for dinner last night. Your cells are rejecting insulin. Not all of them, not dramatically, but enough. Enough to push your fasting glucose higher every single morning. Enough to make your numbers unpredictable. Enough that your doctor keeps adjusting your medication, and the adjustments keep not working. Here is what nobody is telling you. The problem is not your diet. The problem is not your willpower. The problem is that your cells, right now, at this very moment, are dehydrated at a level so deep that insulin physically cannot do its job. No matter how perfectly you eat, no matter how faithfully you take your medication. And the consequence of that silence? 60% of seniors with uncontrolled blood sugar develop peripheral neuropathy. That is nerve damage. It starts as tingling in the feet, then numbness, then a wound you cannot feel that does not heal, that becomes infected. That leads to a conversation nobody wants to have about amputation, about losing a toe, a foot, the ability to walk to your own bathroom without asking for help. That is what chronic cellular dehydration is doing, quietly, while you follow every instruction your doctor gives you. I am Dr. Megan Foster, 24 years of surgical and clinical experience. And what I am about to share today is not experimental. It is not controversial. It is basic physiology that has been systematically ignored because it cannot generate revenue. By the end of this video, you will understand exactly why your blood sugar is behaving the way it is, and you will have a precise step-by-step protocol to change it, starting tomorrow morning. Now, before we go any further, have you ever had a doctor sit down and actually explain this connection to you? The link between how your cells hold water and whether insulin can enter them? Type yes or no in the comments right now. I am genuinely curious because in 24 years of practice, I can count on one hand the number of times I have seen this taught properly. And stay with me, because there is something I am going to reveal toward the end of this video. A single detail about the timing of your first water of the day. That is responsible for more failed blood sugar protocols than any other factor I have ever studied. Most people hear it and say, that cannot be right, and then they try it. And their morning readings drop more in 2 weeks than they had in the previous 2 years. That is coming. But first, you need to understand why your body is working against you right now. Here's the part your doctor probably skipped. After 60, your body's relationship with water changes completely, not gradually, not mildly, dramatically. And those changes directly determine whether insulin works or fails every single day. 4 things happen, 4 specific measurable things. And understanding them is the difference between fighting your blood sugar forever and finally having control. The first thing, your cellular water channels slow down. Picture a cactus in the desert. The cactus has special pores, microscopic openings, that let it pull water in when it is available and seal shut when water is scarce. Your cells have the same kind of structure. They are called aquaporins, and they are the gatekeepers that let water inside your cells. Now, here is what most doctors never have time to explain. After 60, those gatekeepers stop responding as quickly. They become sluggish, like a door with a rusted hinge. You can pour water into your body all day long, but if those channels are slow, the water cannot get where it needs to go. Your cells stay dry from the inside. A dry cell is a resistant cell. Let me say that one more time. A dry cell is a resistant cell. This means insulin arrives at the door, knocks, and the door does not open. Not because the insulin is broken, not because you did anything wrong, but because the cell is too dehydrated to respond. The Journal of Clinical Endocrinology and Metabolism published research showing that even mild cellular dehydration, just 2% below optimal, reduces insulin receptor sensitivity by 31%. 31%. That is the difference between your morning reading being 120 and 170 from the same meal, the same medication, the only variable, a water inside your cells. Sit with that number for a second, 31% from dehydration alone. But here is what gets more interesting, and this is the part that surprised even me when I first studied it. The second thing that changes after 60, your kidneys lose filtering efficiency, not dramatically, not enough to appear on a routine blood panel, but enough to matter. Your kidneys filter approximately 1 liter of blood every minute at peak efficiency. After 60, that efficiency drops by roughly 30% in most people. This means two things. Your kidneys cannot conserve water as well as they used to, and they cannot help clear excess glucose from your blood as efficiently. Think of your kidneys like a water treatment plant. When everything works perfectly, the plant catches waste and recycles clean water back into the system. When the plant runs at 70% capacity, some waste stays in the system longer. Some of the glucose that should be filtered lingers. It stays in your blood. It shows up on your meter. Now combine that with slow aquaporins, and you have glucose that cannot get into cells and cannot get cleared from the blood. Your reading climbs. Your doctor increases your medication. The medication works harder in a system that cannot support it. The reading climbs again. This is not failure. This is a system problem, not a you problem. And there is a third change, one that almost nobody talks about. Stay with me here, because what comes next is going to reframe everything you thought you understood about why your blood sugar is unpredictable. Your thirst signal delays. After 60, the part of your brain that triggers thirst becomes less sensitive to small drops in hydration. In a younger body, thirst kicks in when you are about 1% dehydrated. In your body now, at 65, 70, 75, thirst may not signal until you are 3 or 4% dehydrated. By then, you have already been operating in a state of cellular drought for hours. By then, your morning glucose has already started climbing. You are not forgetting to drink water. Your body is not reminding you to. That distinction matters more than I can overstate. And the fourth change. This one is about your medication itself. If you take medication for blood pressure, for your heart, for fluid retention, there is a very high probability that your medication is pulling water out of your body as part of how it works. Diuretics, ACE inhibitors, certain diabetes medications at higher doses, they create biochemical conditions that, as a side effect, gradually dehydrate the cells that insulin needs to enter. So here's the situation. Your aquaporins are slow, your kidneys are less efficient, your thirst signal is delayed, and your medication may be quietly working against the cellular environment your insulin depends on, and your doctor has 7 minutes to see you. There is no billing code for sitting down and explaining all of that. It is not your fault. You have been doing everything your doctor told you to do, and the system never addressed the actual problem. Now let me tell you about Dorothy. Dorothy is 72, a retired nurse, which makes what happened to her particularly striking. She spent 40 years helping other people manage their health. She thought she understood hers. Her diabetes had been stable for 9 years, fasting glucose consistently in the 120s, a 1C of 7.1, not perfect, but managed, predictable. Then something changed. No new foods, no missed medications, no stress she could identify. Over 4 months, her morning readings climbed 140, 155, 162. Her doctor ordered tests. Everything came back normal. His conclusion, disease progression. Her medication was increased. Dorothy came to my office with her notebook open. She had been tracking everything, every meal, every reading, every medication dose. And she looked at me and said, "I feel like I am doing everything right and losing anyway." That sentence. I want you to sit with that for a moment, because I have heard it hundreds of times. And it is almost never true that the person has failed. What is almost always true is that they are missing one variable that nobody thought to look for. For Dorothy, that variable was about to reveal itself in a way neither of us expected. But before I tell you what I found, I need to explain the mechanism that makes this entire thing click into place, because once you understand it, Dorothy's story will make complete sense, and so will yours. Here is the insight that changes everything. Blood sugar instability after 60 is often not a carbohydrate problem, not a medication compliance problem. It is a cellular environment problem. When your cells are properly hydrated, insulin binds to receptors on the cell surface efficiently. The cell opens, glucose enters, your blood sugar drops. This is what is supposed to happen. When your cells are dehydrated, the cell membrane becomes more rigid, more resistant, like leather left in the sun. Insulin arrives, but the physical structure of the cell resists it. Glucose stays in the bloodstream. Your body produces more insulin trying to compensate, your pancreas works harder, and eventually, it begins to tire. This is insulin resistance, not always from too many carbohydrates, not always from lack of exercise, sometimes simply from the physical state of the cell itself, from dehydration. A 2022 analysis published in the journal Nutrients, examining data from over 8,000 adults over 60, found that chronically low hydration status was independently associated with significantly higher fasting glucose and A1C levels, independent of diet, independent of medication, the hydration variable alone. 8,000 people. That is not a small study. That is evidence. But here is the part most people skip past. And this is critical. Do not miss this. Volume is not the same as timing. Most people who hear drink more water think, I will have a large glass at breakfast and a large glass at dinner. Done. But your cells cannot absorb water that arrives in floods. They absorb water that arrives in a steady, mineral-rich stream. Think of very dry, compacted soil after a drought. If you pour a bucket of water on that soil, the water runs straight off the surface. It does not soak in. But if you apply a slow trickle over time, the soil gradually softens. The structure opens. It begins to absorb. Your dehydrated cells work the same way. Large amounts of water at irregular intervals pass through your system without restoring cellular hydration. Consistent, smaller amounts, timed correctly, rebuild the internal environment your insulin depends on. This is the difference between people who say, I drink plenty of water and my numbers are still high, and people who use the protocol I am about to share. Now, back to Dorothy. When I asked her to walk me through a typical day, the answer was immediate. Coffee first thing in the morning. Nothing until lunch when she had a glass of water with her meal. More coffee in the afternoon, a glass of wine with dinner, water before bed, total plain water in a day, maybe 12 ounces on a good day. But here was the detail that changed everything. Dorothy woke up every morning between 6 and 6:30. She had her blood sugar reading done by 6:45, and that reading had been climbing for 4 months. I said, Dorothy, between the time you wake up and the time you take that reading, what do you do? She said, nothing. I lie in bed for a few minutes. I get up, I take my reading, then I make coffee. There it was. She was waking up after 7 to 8 hours without a single drop of water. 7 to 8 hours during which her body had been running its nighttime repair processes, using water and not replacing it. And then she was taking her blood sugar reading in the most dehydrated state of her entire day. The reading she was worried about, the reading her doctor was using to justify increasing her medication, was being taken at peak cellular dehydration. But there is something even more important I need to tell you about what happens during those early morning hours. I promised you a revelation. I want you to hold on to that, because what happens between 3 and 8 in the morning is the key to everything, and I am going to give it to you. But first, you need the full framework. Here is the protocol. I call it the WTR framework. W for water quality, T for timing, R for regulation and adaptation. And I am going to give you every detail, temperature, amounts, exact times, because vague advice is what got you here. Precision is what will get you out. Starting with W water quality. Here is what most doctors never have time to explain in a 7-minute appointment. Plain water is not enough. Not after 60. Not for restoring cellular hydration in a system that has been running dry for years. Your cells do not absorb pure water efficiently. They absorb water that carries electrolytes, specifically magnesium, potassium, and sodium. These minerals are not optional. They are electrically necessary. Here is why. Insulin signaling is an electrical event. When insulin binds to a receptor on your cell surface, it triggers an electrical cascade inside the cell. That cascade requires ions, charged particles, to function. Think of your cell membrane as an electrical circuit. Water is the current. Minerals are the wires. Without the wires, the current has nowhere to go. The signal weakens. Insulin knocks. The mechanism does not respond fully. A 2019 study in the journal Magnesium Research found that adults over 65 with low magnesium levels were 63% more likely to have insulin resistance, regardless of their diet or medication regimen. 63% from one mineral. So, step one of water quality. You add a mineral source to your water, not an expensive product, not a supplement stack. 1/4 teaspoon of high-quality sea salt per 32 ounces of water, or a few drops of trace mineral concentrate, available at any health food store for approximately $12 to $15 per bottle. That bottle lasts 60 to 90 days. Now, I need to be crystal clear about something here. If you are currently taking medication for high blood pressure, please talk to your doctor before increasing sodium in any form. Some blood pressure medications work partly by reducing sodium in the system. Adding sea salt could interact with that mechanism. This is a conversation to have with your physician first, not a reason to avoid the protocol, a reason to confirm it is right for your specific situation. If you have kidney disease or are on dialysis, do not add mineral supplements to your water without medical supervision. Your kidneys may not be able to process the additional load. This protocol was not designed for that situation. For most people, a small amount of sea salt in your water is safe and profoundly beneficial. But you are you. With your specific medications, your specific kidney function, confirm with your doctor. Now, water temperature. This one surprises people. Cold water, especially in the morning, actively works against blood sugar control. Here is the mechanism. Cold water triggers vasoconstriction. Your blood vessels tighten in response to the cold stimulus. When your blood vessels tighten, circulation to peripheral tissues, including the small capillaries that deliver insulin to muscle cells, decreases. Less circulation means slower glucose uptake. Slower glucose uptake means higher readings. There is a second effect. Cold water in the morning triggers a mild cortisol response. Your body interprets cold as a mild stressor. Cortisol directly raises blood sugar by signaling the liver to release stored glucose into the bloodstream. This is the last thing you need when your fasting reading is already elevated. Room temperature, or slightly warm, not hot. Approximately 70 to 80 degrees Fahrenheit. That is the range that absorbs most efficiently without triggering a stress response. This single change, switching from cold to room temperature water in the morning, has consistently shown a measurable difference in fasting glucose readings within the first 10 days. Not dramatic, but measurable and consistent. Now let me introduce Harold. Harold is 74, retired carpenter, 12 grandchildren, which he mentions within approximately 45 seconds of meeting you. He has been diabetic for 11 years. He was, as he described himself, a good patient, took his medication every morning without fail, limited his carbohydrates, walked 30 minutes after dinner most days. His A1C was 7.4. His doctor was satisfied, but Harold was not satisfied. He was exhausted, not the kind of exhaustion that sleep fixes. A bone-deep heaviness that had been building for 2 years. He could not finish his afternoon walk without stopping. His hands had begun to feel what he described as slightly distant, like they belonged to someone else. He mentioned it at his last appointment. His doctor said, "That is common with long-standing diabetes." Harold nodded. He drove home, and then he sat in his workshop, where he had built furniture for 40 years, and realized he could not feel the grain of the wood properly the way he used to. He could not feel what he had built his life feeling. He came to me the following week. But what Harold revealed when I asked him about his daily routine, that changed the entire direction of our conversation. I am going to come back to Harold in a moment, because his story connects directly to the most important thing in this protocol. First, let me walk you through the 3 invisible mistakes that almost every senior with blood sugar issues is making right now, without knowing it, because these 3 patterns are quietly amplifying insulin resistance every single day. The first invisible mistake: counting coffee, tea, or juice as water. I hear this constantly. I drink plenty of fluids. But here is what most doctors never explain. Coffee is a diuretic. Every cup of coffee you drink requires an additional 8 ounces of plain water just to offset the dehydrating effect. If you drink 2 cups of coffee in the morning, you are starting your day 16 ounces in the negative before you ever count what you actually need. Tea has a milder effect. Juice spikes blood sugar directly. Your cells need water, not flavored liquid, not caffeinated liquid, water with minerals. This is not the same thing as staying hydrated with fluids. The second invisible mistake: drinking water only when thirsty. You already know that your thirst signal is delayed after 60, but here is what most people do not realize. By the time you feel thirsty, you have already been in a state of meaningful cellular dehydration for 2 to 3 hours. Those are 2 to 3 hours during which insulin was working at reduced efficiency, during which your readings were quietly climbing. Drinking in response to thirst is reactive management. The WTR protocol is proactive management. The difference between those two approaches is the difference between spending your day catching up and spending your day ahead. The third invisible mistake: drinking large amounts at once rather than consistent smaller amounts. I mentioned the dry soil analogy, but let me make it more specific. When you drink 16 ounces of water all at once on top of cellular dehydration, approximately 40 to 50% of it passes through your kidneys and into urine before your cells can absorb it. Your body cannot rapidly hydrate dehydrated cells from a flood. It absorbs water gradually through the aquaporin channels we discussed earlier, which are already slow, which is the entire problem. The solution is not to drink more water at once. The solution is to drink at the right time, in the right amount, with the right minerals repeatedly throughout the day at strategic windows, which brings us to tea timing. This is the single most powerful lever in the entire protocol and the most consistently misunderstood. There are 4 hydration windows that determine whether your cells are in an insulin responsive state throughout the day. Miss any one of them, and you are working with reduced capacity for the next 3 to 4 hours. Window 1, 7 to 7:30 in the morning, immediately upon waking, 14 to 16 ounces of room temperature mineralized water before coffee, before food, before checking your phone, before anything else. I want you to hold your question about your fasting reading, because I am about to tell you something about morning timing that will change how you understand that number entirely. This is the revelation I have been building toward. Here is what most doctors never have time to explain. And this is the part that changes everything. Your body begins releasing cortisol at approximately 3 in the morning. This is called the cortisol awakening response. Cortisol is what wakes you up. It gradually raises your alertness. It prepares you to start moving. And as part of that preparation, it signals your liver to release stored glucose into your bloodstream. This is normal. Every human being experiences it. It is called the dawn phenomenon. But here is the critical detail that almost no one explains. When you are dehydrated, as you are after 7 or 8 hours of sleep without water, the cortisol response becomes amplified. Your blood becomes thicker, more viscous. The glucose your liver releases is moving through congested blood, like rush hour traffic on a highway with half the lanes closed, to cells that are already water depleted. The glucose spike from the dawn phenomenon becomes dramatically larger than it would be in a properly hydrated state. The difference is not trivial. Research published in Diabetes Care found that proper morning hydration, taken within 20 to 30 minutes of waking, reduced the cortisol-driven dawn phenomenon glucose spike by an average of 22%. 22%. In the morning reading you track most carefully, from one variable, the timing of your first water relative to waking. This is why Dorothy's readings were climbing. Every morning, she woke up, waited, took her reading at the absolute peak of the cortisol glucose storm, while maximally dehydrated. And then she drank coffee, which is a diuretic, which made everything worse. Her numbers were not telling her that her diabetes was progressing. They were telling her that her cells were parched. The protocol for your morning reading is this: wake up. Do not reach for your meter yet. Drink your 14 to 16 ounces of room temperature mineralized water. Wait 20 minutes. Now take your reading. Take. I can already hear the resistance. My doctor wants my fasting reading before anything. Let me say this clearly. Drinking water does not raise your blood sugar. Water contains no glucose. What it does is reduce the amplification effect of cellular dehydration on the cortisol-driven glucose release. It brings your reading closer to your true metabolic baseline. The reading you are most worried about is currently being measured under conditions that are artificially inflating it. Fix the conditions. Read the true number. Window 2, 30 minutes before your largest meal. 8 to 10 ounces of room temperature mineralized water. Not with the meal. 30 minutes before. Water consumed 30 minutes before a meal begins improving blood viscosity before glucose from that meal enters your system. It prehydrates the intestinal lining, improving absorption efficiency, and it slightly slows gastric emptying, meaning glucose enters your bloodstream more gradually, a smoother curve, a lower peak. The American Journal of Clinical Nutrition published research in 2020 showing that pre-meal water consumption, specifically timed at 30 minutes before eating, reduced post-meal glucose spikes by an average of 17% in adults over 60. 17%. Not from changing what you eat, from when you drink water relative to eating. Window 3, mid-morning and mid-afternoon, approximately 10 in the morning and 2:30 in the afternoon, 6 to 8 ounces each. There is a secondary cortisol peak in the early afternoon, typically between 1 and 3. In a dehydrated state, that peak amplifies blood sugar. In a well-hydrated state, the effect is dampened. The mid-morning window prevents the gradual cellular dehydration that builds through the morning. The mid-afternoon window addresses the secondary peak before it can spike your readings. Window 4, 2 hours before bed, 6 to 8 ounces, no more. Not right before bed. 2 hours before. This distinction matters. Water taken immediately before bed increases nighttime urination. Disrupted sleep raises cortisol. Elevated nighttime cortisol raises morning glucose. You have now created the exact problem you were trying to solve. 2 hours before bed gives your kidneys time to process the water and begin overnight filtration without the urgency that would wake you up. Now, back to Harold. When I asked Harold to describe his water intake, he was quiet for a moment. Then he said, "I drink 2 cups of coffee in the morning, and I have a protein shake around noon." I said, "And water? Plain water?" He looked slightly embarrassed. He said, "I guess I never really thought about it. I am not telling you this to make Harold feel foolish. I am telling you this because Harold is typical. I have asked this question to hundreds of patients over 60. The answers almost always reveal the same pattern: coffee, tea, maybe 1 glass of water if they remember. Harold was chronically dehydrated at the cellular level, while following every other instruction he had been given perfectly. His cells were resistant to insulin not because his insulin was failing, but because his cells had no water to work with. The slight distance in his hands, the numbness at the edges, that was early peripheral neuropathy, not advanced, not irreversible at that stage, but real and accelerating. I told Harold something I tell every patient in that situation. The cells that are still alive are worth saving. We can slow this significantly, but we need to start now. Harold opened his phone right there in my office and set 4 alarms: 7:15, 10 in the morning, 2:30, 8:30 at night. He labeled each one with the window number. He said, "I am a carpenter. I understand that the right tool at the right time makes all the difference." That was week 0. Let me tell you about week 1. I am not going to tell you week 1 is comfortable. It is not. Your body has been running dry for months, possibly years. When you introduce structured hydration at consistent windows, your system begins recalibrating. You will use the bathroom more, significantly more, for the first 7 to 10 days. This is not a problem. This is your kidneys starting to function at a higher capacity. This is old, stagnant cellular fluid being replaced by fresh, mineral-rich water. This is your body beginning to flush what accumulates when circulation is compromised. It is inconvenient. I will not pretend otherwise. Harold called me on day 4. He said, "I am spending half my time in the bathroom." I said, "Harold, that means it is working." He was not entirely convinced. Most people quit here. They decide the protocol is not working. They go back to 2 cups of coffee and a protein shake. If that is on your mind, here is what you need to hear. The discomfort of the first week is your body doing exactly what you need it to do: rehydrating, recalibrating, rebuilding. The discomfort does not mean stop, it means keep going. The discomfort confirms the protocol is working. Now, let me walk you through what to expect week by week. Week 1, days 1 through 7. More urination. You may notice slightly more energy from the window 1 water. Some people notice less heaviness after meals. Blood sugar readings may vary. Do not expect dramatic changes yet. Your cells are just beginning to rehydrate. Week 2, days 8 through 14. This is when most people first notice that their fasting reading is different. The number that was 155 might be 148. The number that was 170 might be 158. Small differences, but in a consistent direction. Week 2 is also when post-meal spikes begin to smooth. The sharp peaks begin to flatten into a slope. Week 3, this is the week that changes people. This is when the cells have been consistently hydrated long enough that insulin receptor sensitivity genuinely begins to recover. The aquaporins begin responding faster. The cell membranes soften from the inside. Insulin binding improves. I have heard the same description from patients in week 3 so many times that I began writing it down. They say, it feels like something released, like I was fighting a wall and suddenly the wall gave. Week 3 was when Dorothy first called me. Her voice was different. She said, "My morning readings this week have been in the 120s and 118s. I have not seen numbers like this in 8 months." "What is happening?" I said. "Your cells are finally getting what they needed." Dorothy's morning readings over those 3 days. Tuesday morning, 124. Wednesday, 119. Thursday, 121. After 4 months of readings above 150. Week 4 and beyond. This is when your A1C begins to move. The A1C measures your average blood sugar over approximately 90 days. It does not change fast, but at the 90-day mark, if you have been consistent, you will see it. A 0.4, a 0.6, sometimes a full point drop. From hydration, from timing, from minerals, nothing else changed. Now, before I continue, if this information is reaching you in a way that no appointment ever has, hit the like button right now. It costs you nothing, but it tells the algorithm that this kind of careful, detailed guidance matters, and it puts this video in front of someone else who needs it tonight. Now, R, regulation and adaptation. The third component. This is where most protocols fail, not because the protocol is wrong, but because the variables change and nobody accounts for them. Your hydration needs are not constant, they shift. And knowing when and how they shift is what separates people who maintain their results from people who plateau after 4 weeks. Variable 1, medications. If you take a diuretic for blood pressure or heart function, add 8 to 12 additional ounces of water per day spread across your windows, not in addition to one window. Distributed. Your medication is actively pulling water from your system. You need to replace it. If you take metformin for diabetes, drink your window 1 water at least 30 minutes before your morning dose, not after, before. This gives your kidneys a head start. And speak with your doctor if you are on higher doses, as metformin at higher doses can affect kidney hydration status in some individuals. One thing I need to say directly: never adjust the dose or timing of your prescribed medication without your doctor's approval. What I am describing is the timing of your water relative to your medication, not a change to your medication itself. Variable 2, seasons. In winter, indoor heating systems pull significant moisture from the air. Invisible dehydration. You are not sweating. You are not thirsty. But the warm, dry air of a heated home is pulling water from your skin and respiratory system constantly. I see more unstable blood sugar readings in January and February than any other months, not from holiday eating, from winter dehydration in the months that follow. In winter, add 4 to 6 additional ounces to your morning window. Slightly increase your mineral concentration. And consider a humidifier in your bedroom overnight. Your cellular environment during sleep directly affects your dawn phenomenon reading. In summer, sweating accelerates mineral loss more than water loss. The mineral component becomes more critical. A pinch of sea salt in every glass, not just the morning glass. Variable 3, exercise. Exercise normally lowers blood sugar by increasing glucose uptake in muscle cells. But if you begin exercise while dehydrated, your cortisol increases, your circulation to muscle tissue decreases, and your blood sugar can actually rise during exercise instead of fall. I have seen patients completely confused by this. They walk after dinner, and their bedtime reading is higher than their post-dinner reading. Dehydration before exercise. Almost always the explanation. Drink 8 ounces of mineralized water 30 minutes before you start moving, and 8 ounces within 30 minutes of finishing, every time. This ensures exercise has the blood sugar lowering effect you are trying to achieve. Now, Harold at week 3. Harold sent me a photograph of his notebook, not a digital record, a paper notebook with a blue cover, the kind he kept in his workshop for measurements. He had been writing down every reading, every window, every glass of water. Day 1 fasting, 173, day 7, 161, day 14, 148, day 21, 132, 173 to 132 in 21 days. Same medication, same meals, same 30-minute walk after dinner. The only change, 4 glasses of mineralized room temperature water at specific windows each day. Harold's note at the bottom of that page said, "I can feel my hands again, not perfectly, but better, like the volume turned back up." Let me stay with that image for a moment. The volume turning back up in his hands, that is peripheral circulation recovering as blood viscosity decreases, as hydrated blood moves more freely through the small capillaries that serve the extremities, as glucose begins entering the cells that need it instead of pooling in his bloodstream. This is not a miracle. This is biology finally getting what it needed. But now I need to tell you about the mistake that Harold almost made at week 4, because this mistake is the most common reason people plateau. At week 4, Harold felt so much better that he became flexible. He skipped the mid-morning window for 3 days in a row. He reasoned that he was already doing well. He could ease up a little. By day 29, his fasting reading was 144, up from 132. He called me slightly panicked. I said, "Harold, tell me what changed." He went quiet. Then he said, "I missed some windows." Here is something critically important, and I want you to hear this clearly. Cellular hydration is not a reservoir. You cannot fill it up and then stop. Your cells continuously use and lose water through normal metabolic processes, hormonal fluctuations, medication effects, normal daily function. If you stop providing the steady input, the cells begin drying out again within 48 to 72 hours. The good news, recovery is equally fast. Harold went back to all 4 windows that day. By day 33, his reading was 128, 5 points better than his previous best. Consistency beats intensity every single time. Now, I want to address something I know is on your mind, and I want to address it directly. You might be thinking, this sounds too simple. If drinking water at the right time could affect blood sugar this significantly, why is no one talking about it? Here is the honest answer. It is not that no one knows. It is that the system has no mechanism to communicate it to you. A 7-minute appointment is optimized for prescription management. There is no billing code for hydration counseling. Insurance does not reimburse it. Your doctor may know this information. But between renewing your medication and reviewing your labs, there is no time to explain aquaporins and cortisol curves and mineral conductance. This is not a conspiracy. It is not malice. It is a structural failure. The system is designed to treat symptoms, not restore environments. And cellular dehydration is an environmental problem. The information exists in journals, in clinical experience, in the research I have just walked you through. But the pathway from that research to your kitchen table is broken. That is why I make these videos. And now let me tell you about Dorothy at week 8. Dorothy came back to my office at the 8-week mark. She had her notebook. She was precise about everything. 40 years as a nurse. Her fasting readings over the previous 2 weeks had averaged 119. Her previous 2 month average before starting the protocol, 158. A 39-point drop in average fasting glucose from hydration, from timing, from a quarter teaspoon of sea salt in her morning water. But the number that changed everything was her A1C at the 12-week mark. 7.1 had become 6.7. Her endocrinologist, who had been discussing increasing her oral medication, called her instead to discuss reducing it. Dorothy called me after that appointment. She said, "I have been a nurse for 40 years. I helped patients manage their diabetes for 4 decades, and nobody ever sat down and explained this to me." Let me say that again. A trained medical professional, 40 years of clinical experience, and the connection between cellular hydration and insulin sensitivity was never explained to her in all those years. It is not your fault that you did not know. The system failed to tell you. Today, that changes. Now, I want to give you realistic expectations because I believe in telling you the complete picture. This protocol does not work identically for everyone. Dorothy's 39-point drop is on the higher end of what I typically see. For some people, the drop is 15 points. For others, 25. The research shows an average improvement in fasting glucose of approximately 18 to 24% with consistent structured hydration over 90 days. Your results will depend on your baseline dehydration level, your current medications, your kidney function, your mineral status, and your consistency. What I can tell you with confidence is that of all the variables I have studied and applied in 24 years, this one has the highest ratio of impact to effort. You are not changing your diet. You are not adding medication. You are changing when and how you drink water, and the cellular environment responds. If after 45 to 60 days you see no measurable change, then other variables need investigation with your doctor. But in my experience, anyone who follows the 4 windows consistently with mineral-enriched room temperature water sees some improvement every time. Now, Harold at week 6. Harold came in for his follow-up appointment. He sat down across from me and did something I was not expecting. He placed a small piece of oak on my desk. Smooth, beautifully finished. He had made it in his workshop the previous week. He said, "I cut that myself. I sanded it myself. I can feel the wood again." Then he said something I wrote down immediately after he left. He said, "I thought that was just age. I thought I was supposed to lose that. I thought it was just what happens." I said, "Harold, sometimes what feels like age is something much more fixable than that." His A1C at the 90-day mark, 7.4 had become 6.9. His doctor, who had been satisfied with 7.4, was now talking about whether they could aim for 6.5. His peripheral sensation had continued improving, not completely restored, but meaningfully better, enough that he could return to the woodworking that had defined his life for 40 years. Enough. Now. Here is what I need you to do, not next week, not after you finish this episode of whatever you are watching later. Tonight, put a glass on your nightstand. Fill it with room temperature water. Add a small pinch of sea salt. Put it next to your blood sugar monitor. Tomorrow morning, when you wake up, before you reach for your phone, before coffee, before your meter, drink that glass. Wait 20 minutes, then take your reading. Write both numbers down, the date, and the time between waking and drinking water. Do that for 7 days. 7 days of that data will tell you more about what is actually driving your fasting glucose than the last 6 months of readings taken under peak dehydration. And here is something deeper I want to leave you with. The emotional weight of blood sugar instability is something I see in my office every week. The guilt, the frustration, the feeling that your body is betraying you. Every high reading feels like failure. Every medication increase feels like proof that you are not trying hard enough. And the advice keeps getting more restrictive. Eat less, move more, be perfect. It is exhausting, and it is often misguided, because if the cellular environment is not right, No amount of restriction will fix it. You cannot willpower your way to better aquaporin function. You cannot discipline your way out of cellular dehydration. You need to restore the environment first. And that is what this protocol does. It gives your body what it needs to respond to everything else you are already doing. Your body wants to regulate blood sugar. It wants insulin to work. It wants glucose to enter cells. But it cannot do any of that in a dehydrated state. It is like asking an engine to run without oil. The fuel is there, the engine is there, but the system cannot function. Add the oil, and everything else works better. Not because you changed your diet, not because you added medication, but because the environment changed. Your cells can finally respond. You have not been failing. You have been working with incomplete information. Today, that ends. Type "I finished" in the comments if you watched this to the end. And then, right now, not tomorrow, share this video with one person, your husband, your wife, your sister, your best friend who checks their blood sugar every morning and cannot figure out why the numbers keep climbing. They need this today. Subscribe and turn on the bell notification because next week, I need to tell you something that will challenge everything you have been told about what raises blood sugar in the morning. There is one thing most seniors do within 15 minutes of waking. That is not food, not coffee, not medication. That amplifies the dawn phenomenon more powerfully than almost anything else I have ever measured in a patient. I almost did not include this in next week's video. It is going to upset some people. But you need to know. Take care of yourself. I will see you next week.